Hello everyone, I am Dr. Kriti Agarwal, an IVF consultant from Kolkata, and today we are going to talk about the most commonly asked question during our open: is IVF a painful process? Before we get to the answer, is IVF painful or not, it is important to understand the steps of an IVF cycle. So it involves essentially 3 steps. First would be the ovarian stimulation, second would be the egg retrieval, and third would be the embryo transfer. So coming to the first step, which is the ovarian stimulation, it involves receiving injections daily in your tummy through a very thin needle starting from day 2 of your period. So these injections are given for about 10 to 12 days to stimulate your ovaries to produce multiple eggs, which would later on be collected during the egg retrieval process. So these injections have very thin needles similar to the insulin pen, which many diabetics take daily, and it does not cause any pain. So coming to the second step, which is the egg retrieval, that is done as a daycare procedure. It is done under anesthesia. There are no cuts in the body. So there is no post-operative pain, there is no intraoperative pain. So there's no pain during the procedure and no pain post the procedure as well. And there is no prolonged hospitalization involved. It is a daycare process, meaning you get admitted and discharged on the same day, and you can resume your normal activities from the next day. There is no bed rest recommendation from IVF specialists. Coming to the third step in an IVF cycle, which is the most important one, that is the embryo transfer. Now this process also does not require any anesthesia. It is done under ultrasound guidance, and it does not involve any cuts on the body, and the patient experience is similar to that of getting an ultrasound done or a pap smear done. So here also there is no pain involved. Now after the embryo transfer is done for 2 weeks, we advise to get progesterone injections administered daily, and that can cause some discomfort. But if it is causing too much discomfort, we can switch over to vaginal routes for better patient compliance. So as far as physical pain is concerned, IVF does not cause much physical pain. In fact, there's just little discomfort of injections, that too post embryo transfer. But what IVF does cause is mental stress and financial stress. So these factors need to be considered before planning an IVF cycle rather than the physical pain, because IVF is not a big surgery involving prolonged hospitalization, prolonged bed rest. It can very well be done as a daycare procedure, and it is a medical procedure, not a big surgery. So please don't be scared of IVF, that it involves lot of bed rest and lot of cuts in the body. There is no cuts in the body at all.